Good evening and welcome to our webinar, Pulling Back the Curtain, Lies, Fraud, and Naked Profiteering in Medicare Privatization Schemes with our honored speaker tonight, Wendell Potter. I'm Karen Richter. I am the co-president of PSARA, the Puget Sound Advocates for Retirement Action. With me tonight is Jeff Johnson, my co-president, who will be handling the question and answer part of our program, and Mike Andrew, our executive director, who's managing our webinar. Before we begin our program, I'd like to talk about PSARA just briefly, for those of you who might not be familiar with us and the work that we do. PSARA is a nonprofit grassroots organization of activists. Our mission is to preserve and expand Social Security, Medicare, and Medicaid, and to advocate for healthcare as a basic human right, to speak out strongly in defense of working people and marginalized communities, and to put the needs of the people on the planet first. We want all generations to be able to retire with dignity and in a healthy environment. So last year, we became aware of a Trump-era scheme to completely privatize traditional Medicare, renamed by the Biden administration as ACO REACH. Basically, this program sweeps Medicare beneficiaries enrolled in traditional Medicare into a privatized form of Medicare. And it does that by inserting middlemen between a doctor and the patient, often without the beneficiary's knowledge or consent. We work with local leaders, with regional, state, and several national organizations, elected officials like Pramila Jayapal, to stop ACO REACH in its tracks. But we were not successful, and it continues to this date and beyond. This year, we broadened our fight, joining other organizations around the country to take on all forms of Medicare privatization. In a few minutes, Wendell will discuss how insurance companies manipulate customers with false advertising so they can fleece a Medicare trust fund and walk away with huge profits. To find out more about PSARA, I encourage you to check our website, psara.org, and look for our newsletters and our past webinars. And while you're there, please take a moment to become a member of PSARA. It's only $20 a year, and you receive our monthly 12-page newsletters with articles by people like our honored speaker tonight, Wendell. So, just a real tad bit of housekeeping. We have a Q&A period. It's important to put your questions in the Q&A function and not the chat. If you do click on the Q&A function, it's at the bottom of the Zoom screen. Questions in the chat are likely not to get asked, so please use the Q&A. So thank you. After Wendell's presentation, stay tuned because we're going to have some actions for you, so please stick around. So now on with our webinar. I am really honored tonight to present Wendell Potter, our featured speaker. Wendell is a former healthcare company executive who became that industry's worst nightmare. Time magazine called Wendell the ideal whistleblower. Bill Moyers called him a straight shooter. Michael Moore called him the Daniel Ellsberg of corporate America. Wendell walked away from his job at Cigna, the giant healthcare insurance corporation, in 2008 after what he described as a crisis of conscience. Now Wendell is president of two organizations, the Center for Health and Democracy and Business Leaders for Healthcare Transformation, working to end the employer-based health system as it is and to guarantee healthcare for all Americans. Wendell's newsletter is Healthcare Uncovered, and it's essential reading for anyone trying to figure out how the insurance industry is making huge profits on our healthcare needs. Wendell is also a best-selling author. The New York Times called his first book, Deadly Spin, a tour de force. Pulitzer Prize-winning author and historian Doris Keene Goodwin called his most recent book, Nation on the Take, a stirring guide for how we can work together to reclaim our democracy and reunite our country. So please join me in welcoming Wendell Potter.
Karen, thank you so much. I really appreciate that wonderful, warm introduction. I'm going to talk a little bit this evening about the history of privatization. I touched on that in the piece that I wrote for PSARA that I think was published in your newsletter. I began that piece actually in 2015. I'm going to go back a few years earlier. And I'm going to I do that to make the point that politicians have been trying to privatize the Medicare program almost since the very beginning of the program. Although in 1965, the term health maintenance organization, or HMOs, hadn't even been coined yet. We saw some of the beginnings of private companies beginning to be involved in Medicare. And that's because you had entities like Kaiser Permanente and Group Health of Puget Sound and Geisinger in Pennsylvania, where I live. So accommodations were made to fold them somewhat into the Medicare program. I'm going to read a couple of things here for you. The Medicare program recognized prepaid health care plans as a different kind of entity for which a different kind of payment method was necessary. In 1965, prepaid plans were accommodated by permitting those plans, like Kaiser, to be paid on a reasonable cost basis for services such as physician services that the program would otherwise be paying on a different charge basis. This approach to payment made sense in that, and I'm quoting here, in that if the HMO-like organizations used salaried positions like physicians like Kaiser does, there'd be no service-by-service billing by the physicians, and therefore no charge other than the aggregate charge, which is a salary for any kind of services rendered by the physician. So I mention that just so you know that there have been efforts along the way, even from the very beginning of the program, for private companies to be a part of Medicare. But just 3 years after the Medicare program was created during the Johnson administration, Richard Nixon was in the White House, and soon he would maintain that for everybody who was not in either Medicare or Medicaid, healthcare costs were becoming a very big problem in the United States. And here's what I wrote actually in my first book that Karen mentioned, Deadly Spin. The implementation of Medicare and Medicaid consumed enormous attention in government and the healthcare world for the next several years. But by 1970, growing healthcare costs and increased numbers of uninsured Americans among the non-elderly renewed the debate about more drastic healthcare reform. It was President Richard Nixon who helped sound the alarm, saying, "We face a massive crisis in this area. Unless action is taken within the next 2 or 3 years," this was in 1970, "we will have a breakdown in our medical system." He was supported by the normally conservative media, including Businessweek and Fortune magazines, which had cover stories and special issues declaring that American medicine stood on, quote, "the brink of chaos." Polls showed that 75% of American households agreed there was a crisis. Senator Ted Kennedy, chairman of the Senate Health Subcommittee, opened fire in 1971 with renewed promotion of national health insurance, in other words, single-payer health care. Nixon responded with his own plan, which would mandate employer health coverage for all working Americans and would require employers offering traditional indemnity coverage to also offer a prepaid group plan called, for the first time, a health maintenance organization. Nixon had been persuaded by some folks to take a look at Kaiser, and he became a very big fan of Kaiser. And so he felt that that's just what this country needed. And so during his administration, we saw the passage of the Medicare, the Health Maintenance Organization and Resources Development Act of 1972. And that required companies with 25 or more employees to provide an HMO option. So that was kind of the beginning of HMOs getting not only involved in Medicare, but in the rest of the country as well too. One thing I wanted to note is that I was at Cigna for about 15 years, but it's not as well known that prior to that, I was at Humana for 4 years. And I also, before that, worked for regional hospital system in Knoxville, Tennessee. And one of the reasons I was hired by that hospital system was to help its fledgling HMO get off the ground. During that time, a lot of hospital systems around the country were trying to get into the HMO game, and most of them did not succeed ultimately. Some of them did, but most of them eventually sold their HMOs to bigger players. That was in the mid 80s. And in 1989, I was recruited to Humana. And I was there for 4 years. And when I joined Humana, Humana was largely known as a hospital company. But it also had just recently got involved in the HMO business, and in particular, the Medicare HMO business. It was one of the first companies in the country to see Medicare as a potential cash cow. In 1985, while I was still at the Baptist Health System of East Tennessee, there were 480 operating HMOs in the U.S. and 87 Medicare risk contractors. By the end of 1987, the number of risk contractors rose to 161, which became a high watermark for the first 10 years of the program. Risk enrollment rose in every year from 1.1 million at the end of 85 to nearly 2 million by the end of 1990. So not a lot of growth, but there was some growth in the Medicare privatization area. As measured by beneficiary interest in the program, Medicare managed care in areas where it was offered and included additional benefits was becoming a highly successful program, in particular in South Florida. In that part of the country, Medicare HMOs offered drug coverage for the first time and low out-of-pocket costs through zero premium plans. I know we've heard that quite a bit in recent years, but that goes back to the mid 80s. During the early years of HMOs in Medicare, the largest Medicare contractor was a company called International Medical Centers, or IMC, and it was based in Florida. And it began as a demonstration project, sort of like what Karen referenced to a few minutes ago with direct contracting. Back then, that demonstration project consisted almost exclusively of Medicare enrollees operating under the authority of a waiver from the federal government. IMC had enrolled over 100,000 Medicare beneficiaries around this time. But as we've seen many times over the years, the folks who ran IMC and other insurance companies and HMOs got pretty greedy, and they got caught. Here's an excerpt from an article from that time. In 1986, the federal government task force was established to investigate charges of corruption and fraud on the part of Miguel Recarey Jr. Recarey was then head of IMC, which was at that time America's largest HMO. During its peak years, International Medical Centers received $360 million a year in U.S. government Medicare funds. It seems almost cute by today's standards. In April 1987, the first indictment was returned in Miami, Florida, against Recarey and 3 co-defendants for conspiracy, bribery, obstruction of justice, and illegal wiretapping. The IMC crisis for Medicare and for Medicare enrollees of that organization was alleviated when Humana rushed in and took over the operation of IMC. Folks, looking back at that time, that would be one of the best decisions that Humana had ever made. I was recruited, as I said, to Humana about 3 years before this. At the time, Humana was largely known as a hospital company, and I was recruited to support the scores of hospitals that Humana had, well over 100 in the U.S. and abroad, particularly in England. By that time, Humana had also, though, set up a second division to operate the Medicare HMO business that it had bought or taken over in Florida. And it was growing fast and spreading beyond Florida. I can remember very vividly getting involved in some of the meetings that Humana had in Fort Lauderdale and Miami during that time. And it was clear to me that that was going to be a very profitable business for Humana, because Humana had figured out how to cherry pick seniors to enroll in their Medicare plans. And that was kind of a hallmark of the industry for many years. But finally, the federal government during the Clinton administration began to catch on to what was going on and decided, well, we needed to the government needed to crack down on this cherry picking because other companies were looking at the Medicare program and were getting into that business. And in fact, some of the big insurance companies like Aetna and ultimately Cigna and other companies like Prudential and MetLife at that time were getting involved in Medicare. So ultimately, the government decided it had to do something to try to end the practice of cherry picking and lemon dropping, which was another thing that was going on. These companies would go to great lengths to get rid of HMO enrollees as they got sicker. So they would figure out ways to try to disenroll some of those patients or those enrollees. So Congress passed legislation that set up a risk scoring system, and this was done in a way that paid insurance companies more to enroll people who had health conditions that would lead to more expensive medical care. And so that is in place yet today and has led to the companies that are in this program to manipulate that system, as these companies are always able to do, to get far more money from the federal government than they're entitled to. The industry has, several agencies of government like the OIG, MedPAC, and others have written over the years about how much these companies have been overpaid by the federal government in these risks by manipulating the risk scoring system. But to a large extent, CMS and Congress has just kind of looked the other way, while these companies have been making out like bandits and increasing their presence in the Medicare program. That piece I wrote for Passera, as I said, began in around 2015. I had left Cigna by this time, but let me back up just a little bit. That the Medicare program was seen as a very attractive program for a lot of companies, including Cigna and including Aetna, as I mentioned. But in 1999 and 2000, again, this was toward the end of the Clinton administration, the government decided to crack down on some of the profiteering in the Medicare HMO business and passed some legislation that made it less profitable for these companies to participate in Medicare managed care. Cigna decided that the federal government was just not a reliable partner. I was at that time head of corporate communications. I had risen up the ranks and was by then leading communications for Cigna. And I can remember very, very clearly the decision that the company made in late 1999 to get out of all of the markets that Cigna was serving in Medicare, all but one. It decided to stay in Phoenix, but the company decided it just couldn't make enough money fast enough on Medicare, so it got out, leaving hundreds of thousands of people stranded, trying to figure out what they were going to be doing. Could they go back into traditional Medicare? There are problems associated with that. Or trying to find another company that offered a Medicare option. At that time, the program was called Medicare Plus Choice. And as more and more companies decided to get out of the business, the program seemed to be imploding. But then the Bush administration began, George W. Bush, and he and Republicans and encouraged by private businesses, in particular private insurance companies, begged the Congress and the president to do something to make it once again more palatable for insurance companies to participate in this program. The program became when it became Part C, or Medicare plus Choice, that was the first time it was designated around that time as Part C. So we're seeing now that the Medicare program, which had originally been Part A and Part B, now had a Part C, which was this private Medicare program. In 2003, during the Bush administration, and during a time when Republicans also controlled both houses of Congress, they passed what was referred to or called the Medicare Modernization Act of 2003, which once again made it more palatable, threw some bones at the industry in ways to encourage them to come back into the program. Certainly, it's been, from the very beginning of the Medicare program, the ambition of Republicans who didn't want it to be established in the first place for private companies to take it over. And so with the Medicare Modernization Act of 2003, that just set things in motion for these companies to begin coming back into the Medicare program. Aetna certainly came back in a pretty significant way, Cigna to a certain extent. But then you got a company like United Healthcare seeing that there could be a lot of money to be made in Medicare. They watched what Humana was doing. They ultimately partnered with AARP to begin offering not only Medicare supplement plans, but Medicare Advantage plans. And that law in 2003 was the law that created that term Medicare Advantage, the one that we are still using, or that the industry still uses to market as plans. So ever since then, we've seen more and more growth of this program, to the point that this year we saw for the first time the dreaded crossing over 50%, with more than half of Medicare beneficiaries now enrolled in Medicare Advantage plans. I noted in the piece that I wrote that in 2015, the health insurance industry decided to look to someone who knew a lot about this program, who knew a lot about the Center for Medicare and Medicaid Services. And they tapped Marilyn Tavenner, who had been President Obama's administrator for CMS. She succeeded Dr. Don Berwick, who sadly had to be a recess appointee because he had at once expressed admiration for the National Health Service in the United Kingdom, and Republicans were just not going to approve his nomination. So Obama did appoint Don to lead CMS as a recess appointee, but recess appointees can only serve a year or so. So he had to step down, and Obama appointed Marilyn Tavenner, who came out of industry, and she stayed there for a few years. But when AHIP, or America's Health Insurance Plans, needed to replace Karen Ignani, who had been very effective for the industry, had led the industry's lobbying during the time that Congress was debating what became the Affordable Care Act. Karen decided that she was going to leave and take a job as president of a New York-based insurance company. So the industry looked to see what they could, who they should replace her with. And by this time, not many people were paying attention to this. I was, but insurance companies were realizing that the commercial insurance space just simply was not growing anymore. It had stagnated. And the big companies like Cigna and Aetna made most of their money working with self-insured companies, serving as third-party administrators, or TPOs. And the only way that they were able to significantly grow their enrollment in these plans was to steal market share from each other. None of these companies really cared that much about the individual market. Some of the Blue Cross plans played in that market, but it never was very robust. And that was because insurance companies could refuse to sell people coverage because of pre-existing conditions, charge them whatever they wanted, discriminate against people because of their age and gender, which are things that the Affordable Care Act fortunately did address. But still, the commercial business had reached the point that it just was not growing. And so these companies realized that there was gold in the federal programs, and so they started focusing more and more on how they could get more and more money out of the federal government, and to make sure that Congress looked the other way at any wrongdoing, or to pay little attention to the fraudulent advertising that these companies were doing, or misleading advertising at the very least. Marilyn was, I think, a brilliant hire for the industry. She knew the ins and outs of CMS. She had great relationships on Capitol Hill. She had been confirmed easily, both in the committee, at the committee level, and at the in the full Senate, overwhelming bipartisan support. Because by that time, even Democrats were saying, well, maybe this is a good thing. Maybe Medicare Advantage is an appropriate part of Medicare. So these Democrats, as well as Republicans, had fallen for the siren call from these insurance companies, and had taken over the years many campaign contributions from private insurance companies. So essentially, the insurance industry bought a lot of members of Congress in both parties. It was protection money, their campaign contributions, in my view, to these candidates, to the point that in recent years, the industry has been able to circulate a letter on Capitol Hill and get the vast majority of members of Congress to sign on to that letter. Until this year. Last year, way more than half of the Democrats in the House and the Senate signed an industry-generated letter, a letter that was written by lobbyists for the industry. The industry used this as a big PR and lobbying tool. But what they would do, they would have their lobbyists go from office to office, getting members to sign on to this letter, which extol the virtues of Medicare Advantage and how important it was for the federal government to keep the fire hose of money going, gushing into these companies. It didn't obviously use that language, but that's exactly what the intent was to keep the cash cow well fed and available to them. You had even people like from the Congressional Progressive Caucus signing this letter. Some of the members, believe it or not, of even the so-called squad signed that letter because they had just been so manipulated or misled by lobbyists for the industry that they signed the letter. I look back with just real dismay at how advocates were not paying as close attention to what was going on as I wish they had. I have written about the insurance industry's involvement in the Medicare program for many years. Soon after leaving Cigna, I have written quite a bit. I began writing a lot about the insurance companies' growing presence in the Medicare program, especially during a time that I was at the Center for Public Integrity. And one of my colleagues there wrote a series of pieces that were just some of the best investigative reporting I've seen anybody do on the Medicare Advantage program, just detailing story after story, the greed, the fraud, the thievery. These were articles that members of Congress read. But again, this was the Center for Public Integrity, a very well-established and highly regarded publication or outlet, but not one that many people knew about. These stories just didn't get all that much traction. This year, for the first time, I think advocates have been able to organize and begin to push back in important ways. I was among a small group of folks who are advocates of Medicare for all and to push back against Medicare Advantage. We were able to brief the Congressional Progressive Caucus in January of this year. And as a consequence of that, many, almost all of the Democrats who had signed the industry's letter in years past said they would not sign it. And that was a significant breakthrough. On the Senate side, they did go ahead with that letter, but they got far fewer Democrats signing it than they had in the past. But on the House side, so many Democrats had said they would not sign that letter, that the industry didn't even circulate it. So that tool was taken away from them as a PR tool. Still, the industry makes enormous profits. Congress has not really taken action in meaningful ways, nor has CMS to really end this privatization or slow it down. However, for the first time, I'm seeing this year that more members of Congress, Democrats certainly, are trying to do their best to have some further investigations of the industry. Regrettably, the Democrats are not in control of the House now, so they cannot schedule hearings or call hearings. If there are already hearings, they have the opportunity to have usually one witness, and Republicans are not very inclined right now to do anything to create bad press for the insurance industry as it pertains to Medicare Advantage. But I think you're seeing that some advocates are beginning to pay more and more attention to this. I'm so grateful that you all are. I think it is possible maybe to at least begin to slow the privatization of Medicare, and hopefully begin to do what happened in, whoops, sorry about that, if you heard that noise outside, but to create a climate like existed in 1999 and early 2000, when insurance companies saw, well, this is not the cash cow that we thought it was. The government is cracking down on the abuses and the profiteering. And we saw many, as I said, many companies, including the one that I worked for, Cigna, getting out of the Medicare Plus Choice business, and less hope that something like that dynamic can be created again. I think it will definitely take a Congress that is controlled by Democrats and a president in the White House who is inclined, a Democrat who is inclined to take the industry on. So we've got to have, to a certain extent, a perfect storm once again to elect Democrats to control both the Senate and the House and the White House before we can expect meaningful progress, I think, in reining in the abuses of this industry. I've rambled on here for quite a bit. I wanted to give that historical perspective, but I did want to encourage everyone not only to focus on direct contracting, which is extremely important. It's the latest wrinkle that began, as Karen noted, in the Trump administration. But Medicare Advantage continues to be an enormous threat. If the number of enrollees in Medicare Advantage continue to grow as it is expected to, I think by 2030, well over 60% of enrollees will be enrolled in a Medicare Advantage plan. So that will mean that the traditional program will be less and less resourced. People will increasingly view the Medicare Advantage program as their best option. And the industry has been able to play on people's ignorance of the program. Their ads have always been very misleading, to the point of conflating Medicare and Medicaid Advantage, Medicare and Medicare Advantage. Most people don't know the difference. They don't know that if they're enrolling in a Medicare Advantage plan, that they are leaving the public program and going into a private program. They're never told in advertisements about prior authorization requirements or limited networks or things like that they should be made aware of. One of the things that I advocate for, along with some members of Congress, is to prohibit these companies from even using the word Medicare in their marketing materials. I co-authored an op-ed with Congressman Ro Khanna of California and Mark Pocan of Wisconsin a few months ago, following the law, the bill that both of those members of Congress introduced that would prohibit insurance companies from using Medicare. And I also co-authored an op-ed with Congresswoman Jan Schakowsky of Illinois on the abuses of the private insurance companies in the Medicare program and the need for policymakers to begin to rein the program in. We need to do more of that. I spent a lot of time in Washington meeting with members of Congress. I know that Congresswoman Schakowsky and others are really determined to try to rein in the program. But as I said earlier, as long as the House is controlled by Republicans, the chances of doing that are pretty slim. I'll end that on that, and we can go to conversation.
Thank you, Joe.
All right, thank you, Wendell. That was incredible, and boy, you got a lot of wonderful comments in the Q&A. Half were not questions, but folks saying how wonderful this webinar is. Can they get a recording of it? They want to share it with others. They've read your stuff. They love you. So you are a superstar. Okay.
Okay. I appreciate that. Thank you so much.
So I scribbled down about close to 20 questions and I didn't get them all. Okay. So I'm going to, there's no way since there were so many, there's no way for me to really have enough time to group them. So I'm just going to go through them. You be the judge of how long you want to answer them,
Sure.
And we'll get through as many as we can. One recurring theme though is, why isn't CMS or Congress recouping the billions of dollars fraudulently obtained through the MA programs?
It is because of the power and influence of these big companies. They've grown to massive size. The reason I wrote Nation on the Tape, How Big Money Corrupts Our Democracy and What We Can Do About It, is to just walk people through how these big companies have not only corrupted our democracy, but have taken over entire industries, or at least have their way with members of Congress and whatever administration is in power. They spend huge sums of money on campaign contributions, and the amount of money they spend on lobbying is immense. And you also have the situation in which we've seen a diminishment of watchdog journalism. I referenced to some of those articles that my former colleague Fred Schulte at the Center for Public Integrity wrote, but you don't see. We just are not seeing that kind of journalism. Occasionally to do. The New York Times a few months ago had a very, very important investigative piece on the industry. And I and a few others helped inform that reporter as she was putting that together. But you don't have enough of that. So there has been, I guess, less public scrutiny, less media scrutiny, and the influence of all this money and politics is sloshing around Washington and the state capitals.
Oh, wonderful. Another person asked, apart from Medicare for All efforts, is there any hope of improving traditional Medicare to include dental, vision, hearing, and other benefits?
Absolutely. It is something that advocates are beginning to really focus on. It's vital that the traditional Medicare program be strengthened. And of course, those of us who advocate for Medicare for All usually pretty careful to say what we advocate for is improved Medicare for all. And you need to improve the benefits, and you need to have out-of-pocket caps on traditional Medicare. People can quickly go broke. In 1965, when the Medicare program was created, it kind of mimicked the way private insurance was at that time. Most policies were indemnity plans that had covered 80% of expenses, and the policyholder paid 20%. That was a prevailing model, so that's what Congress went with. At that time, healthcare costs were just a fraction of what they are now. So we've seen that Congress has not kept up with changing times in terms of the out-of-pocket requirements. People, one reason, of course, that they are lured into Medicare Advantage is because not only the additional benefits, but the help in out-of-pockets. A lot of folks that just don't have the money to buy a Medicare supplement policy to cover their out-of-pockets. But we absolutely need to have vision, dental, and hearing, and long-term care as well. And there are champions for that. And there are those of us who are working with members of Congress. I am on Zoom calls or in Washington often with members and staffers advocating for this. So work is happening. I can't promise you that it will actually ever get done, but I think we're seeing some real movement in that direction.
Oh, wonderful. Thank you for that. Someone else asked, could CMS divorce Part C and qualify it as an alternative private insurance plan?
I don't know that they could do it unilaterally. I think it probably would need to have some kind of congressional action to do that, since Part C was essentially created by Congress. It would probably take some congressional action. I'm just saying that off the top of my head. I don't know that for a fact, but I suspect that would require Congress to act, not just CMS in some kind of executive action.
Okay, thank you. Someone else asked, points out that in California, there's a bill calling on President Biden to end the ACO REACH program. They think it's likely to pass, but in the process of lobbying it, encountered strong resistance from some Democratic Party leaders who refuse to see ACO REACH as a danger. So they're asking you, Wendell, what do you think about this Democratic support for ACO REACH? Where's that coming from?
Oh, it's dismaying, but it's kind of a part of what I was talking about. You've got so many Democrats that have been influenced, I think unwittingly, by the lobbyists for the industry. Keep in mind that these lobbyists are human beings that are successful by developing relationships and being seen as trustworthy and providing credible information. They don't deserve that. In many cases, they absolutely are not doing that. But that's how you are able to get even members of the Congressional Progressive Caucus to sign on as supporters of Medicare Advantage and the ACO REACH program. One thing that they worry about, they have been led to believe that these programs can protect the solvency of the Medicare program. So they fall for stuff like that.
Mm-hmm. Thank you. What do you know about President Bill Clinton's preparing the EGWP law 2 weeks before leaving office, and then when George W. Bush came in, signing it into law?
Well, sadly, I think during the Clinton administration, there were things that were passed that we look back in hindsight and wish we had had a president who saw things from a different point of view. I was at Humana and then Cigna during the last years of the Bush administration, the first Bush, and the first years of the Clinton administration. Spent a lot of time in Washington working with my peers in the industry. We didn't like Bill Clinton at that time. We didn't like the plan that he and Hillary Clinton had put together. We spent a lot of money and worked very much behind the scenes, and I was part of that effort to kill the Clinton plan. Whether if it had passed, it would have been good. I don't know, but it just was. I think the industry showed at that time just how much clout and ability it had to call the shots in Washington, even with the Clintons.
Okay. Well, Wendell, folks from New York City, and you probably know this, the municipal retirees are in a huge fight right now to retain their traditional Medicare coverage. And so this person asked, do you think they can be successful? And please talk a little bit about what you think they're up against.
Well, they're up against a mayor who really is determined to move forward with this. What is happening is that the mayor, Eric Adams, is following up on what another Democratic mayor did. De Blasio was one of those Democrats who fell for the siren call from the industry that the city could save millions of dollars by moving retirees into Medicare Advantage plans. In New York City, the city has for years provided retiree benefits, healthcare benefits that covered their Medicare supplement cost. It's expensive, and the city is, like any city, trying to figure out how they can reduce the budget. And companies like Aetna have come to the administration and to unions representing retirees in many cases, saying that, have we got a deal for you? We can reduce the city's, alleviate the city's budget burden, and all is going to be good. Retirees will have good coverage, and the city can save $600 million a year. It's not really, it's kind of smoke and mirrors, because it's going to work only if the city is getting a chunk of change from the federal government. So the taxpayers in New York City might benefit a little bit, but if they pay federal taxes, and the rest of us are going to be helping to foot the bill here. I was asked and agreed, and it did testify before the New York City Council in January. The Adams administration was trying to get city council to pass legislation to grease the skids for this to go through. I've never seen anything quite like it. I was one of, it turned out, hundreds of people who had signed it to testify that day. The council decided, with that level of opposition, they were not going to approve what the mayor was trying to get them to approve. They never did. But the mayor is trying to, go around them and go through kind of administrative edict to continue to do this. The retirees are fighting this in the courts. I am still working with them, hoping that their legal strategy will prevail. So they're still in the fight, but now it's in the courts.
Yep. Thank you. A related question was, are retirement services divisions of local or state governments, are they rewarded when they move beneficiaries to MA programs?
They can be. These companies sell them a bill of goods, or make this thing seem like the best things in sliced bread, just as they do to individuals to get them to enroll in these plans. They make promises and save you money. They make sure, like in New York City, for example, a lot of the opposition focused on prior authorization within Medicare Advantage, which, in the traditional program, prior authorization is virtually unknown, but it's very prevalent in private insurance and certainly private Medicare Advantage plans. Aetna, which is the company that will administer the Medicare Advantage plan for New York City retirees, if all this goes forward, has claimed that they will reduce the number of procedures for which prior authorization is required. I don't believe them for a minute. They might do it for a year or two, but you can be certain that they will figure out other ways to make sure they're making the money that they need to make out of New Yorkers.
Okay, thank you. These next two questions may be related. If not, you can deal with them separately. But one was, could you explain the risk sorting system and what's its impact on traditional Medicare and/or Medicare Advantage? The second question was, the person was asking you to give some specific examples of fraud. How's it done? How do they do it?
Well, I touched on it a little bit. One, from the very beginning of the program, they were doing all they could to make sure that they shunned people who were sick. This cherry picking and lemon dropping phenomenon that went on for quite a few years. But I would say that the biggest fraud that continues is in the risk scoring part of what is going on here. And what the thing that was put in place again was to address that problem that I just mentioned of paying insurers more to make sure that they were providing coverage and not shunning people because of pre-existing conditions or their health status. What that has done is opened up so many fraudulent activities that insurance companies send nurses, for example, to beneficiaries' homes to do surveys or conduct questionnaires with these people, trying to determine ways that they can claim that this person is sicker than they really are. And that has spawned a whole cottage industry of companies that do that for insurance companies. So that's one thing that has resulted in overpayments of the billions of dollars to these companies over every year. We're not talking about over several years. It's been multi-billions of dollars, but in every year we're talking about many billions of dollars that are going to these companies unlawfully.
Well, thank you. Another question is, if the hospital insurance fund becomes depleted, can you characterize what the outcome might look like for the system?
I don't know that anyone can answer that. The program would begin to pay less to participating providers, presumably. It wouldn't implode, but there would be a reduction in reimbursement, undoubtedly. I mean, you'd begin to see that, and of course, a lot of providers claim already that the Medicare program does not reimburse them adequately. It's one of the reasons why you have a number of doctors who have also been supporters of Medicare Advantage and supporters of private insurance, because private insurance certainly has paid them more. Many reasons for that, mainly because insurance companies don't have the incentive or the ability to negotiate low rates in some cases. But we've never been there before with the Medicare Trust Fund. We always see these reports that the Medicare Trust Fund is going to be depleted in whatever the year is going to be, and then we get closer to that year, then it's pushed out further. I don't think that we necessarily will reach that point, but one of the ways it is being depleted is because of the overpayments to insurance companies. If the government was not overpaying private insurance companies, there would be plenty of money to keep the Medicare program solvent, in my view.
Well, thank you. So this person asks, do you know where they could find out what percentage of folks go from MA programs back to traditional Medicare?
I don't know if I've seen a source that is able to pinpoint or come up with a percentage, but it is fairly significant. And there have been a number of published reports by like the OIG, the Office of the Inspector General. I think even maybe the Congressional Budget Office has looked into this. Private outlets, like I remember several years ago, I was quoted in a story in Kiplinger did on this phenomenon. So it's been going on for quite a long time. What happens, of course, is a consequence of inadequate provider networks and prior authorization requirements. As people get older, they need more services, certainly skilled nursing care in many cases, rehab services, and they find that all too often the provider networks are very skimpy, very inadequate from their perspective. They don't have the highest quality facilities in network often, and there are restrictions and prior authorization requirements. So you see a significant uptick in disenrollment out of Medicare Advantage as people age. The problem, as I alluded to earlier, I think we would see even more if it were not difficult for people to get a Medicare supplement policy when they disenroll.
All right. No, thank you. This person asks, what will it take to not only reverse the radical privatization of Medicare, but to improve Medicare for all?
It's going to take both an offense and a defense. And I think I touched on that in the piece that I wrote for Passara. When I said I was dismayed that advocates, I hadn't seen enough activism, enough advocacy, enough focus on the bad deeds of insurance companies. I hope I don't offend anyone, but a lot of the organizations that have advocated for single-payer healthcare, Medicare for all, I don't think we're as attentive as I wish they were in years past. Again, I started my piece that hindsight is 2020. Looking back, I wish more and more advocates were paying attention and raising a stink about the behavior of companies in Medicare Advantage. I think there's been obviously a big focus on advocating for Medicare for all, but not nearly enough attention focused on here's how bad things are with these insurance companies. So I think we've really got to develop a robust means of informing and talking to policymakers, the media, getting more people focused on just how greedy and bad these companies are behaving. I think that's going to be necessary. I spend a lot of my time writing about just, again, pulling the curtains back to allude to the title of our program here. That's what we really need. We need more focus, more organizations and individuals doing just that, doctors and patients, to just really make their members of Congress, the media, more and more aware of just how awful these companies can be for people.
Well, no, there are now 99 total questions. So, so I'm going to do a few more, and then we'll turn it back over to Karen and maybe last comments from you. But so this one has come up in other webinars we've done, and so we'd like to get your take. This person says, many of my friends are on MA plans and they like them, and they could not afford the traditional plans. Yeah. They've had good luck so far with their plans. How do you respond to them?
Yeah, and that's the biggest hurdle, I think, is because the traditional program, because it doesn't have an out-of-pocket cap, because it doesn't, except for now Part D, fortunately, and that's not even in effect yet. That was a major accomplishment, by the way, to get a cap on Part D. Certainly Part D falls short in many ways, but at least it now will soon, hopefully, have a cap on spending, out-of-pocket spending. But in the absence of a cap on the other parts of, parts A and B, and no vision, dental, or hearing, it's easy to sell someone. I was visiting my parents in Tennessee several years ago. They since have passed, of course. But while I was visiting them, there was a fellow from their church who was also spending some time with them. It turned out he worked for Humana, and he peddled Humana's Medicare Advantage plans. And I'll never forget something he said during that time. He said, it's like shooting fish in a barrel. When you talk to a beneficiary, we can give you more benefits and make sure you have lower out-of-pockets, and then not tell them what the shortcomings are. That's what shooting fish in a barrel is all about. So, and the other thing is, most of us, even as we get older, we're fortunate to go year in and year out in reasonably good health, not testing the awfulness of Medicare Advantage plans until we get sicker and needing rehab or skilled nursing care or things like or find that something is denied. But people also have gotten accustomed to that in private insurance plans. They don't really have an understanding that that's not the way Medicare really operates. So there's this enormous ignorance, and it's understandable. People don't pay a lot of attention to the ins and outs of health insurance or Medicare, so they're easily bamboozled, sadly.
Thank you. So this person asked this question. I think it comes out of frustration with, just the shock of how quickly the system is being privatized and, what we can do about it. So the question is, would a class action suit against, by anti-privatization groups be a possible strategy to stop this rapid privatization of the Medicare system?
I think it's possible. I have talked to law firms that have taken on companies. The problem is getting a class, and there's some hurdles there, or we would have seen them already taking shape. However, I know there are law firms, I've worked with some of them, that have represented clients who've been enrolled in Medicare Advantage plans fraudulently. So I think the courts can be a way to begin changing things. I think that's important. Getting a class of individuals who can demonstrate harm, I'm sure it must be challenging, and we'd see that already.
Good point. So this person is a different take on this issue. It says members of Congress are largely educated with relatively large educated staffs. How is it then that Democrats in particular collectively do not have the data analysis to understand the grift that is happening? Maybe they're not as innocent as some suggest.
Well, that's true, but the members of Congress and staff are just hit with a fire hose of stuff every single day. I guess I'd say I've been blessed to have had the privilege of being in and around Congress for about half a century. I was a newspaper reporter in my very first career, and I was fortunate enough to cover Congress in the 70s, right after the Nixon administration, in the first years of the last years of the Bush administration, first year of the Carter administration. I married a congressional staffer from that period of time, so I know that the enormous amounts of information they have to digest. There you have a situation in which most members of Congress, unless they are on a committee of jurisdiction, have a very shallow understanding of healthcare. It's enormously complex in the first place. And you also have the phenomenon, again, related to money and politics, of lobbyists at their doorstep all the time with slickly packaged information. And you have, on the other side, very infrequent visitors. There's this great imbalance. You don't have, the people don't have that kind of representation, sadly, in Congress. I think most members of Congress go there hoping to do good for their constituents, and for various reasons that we've talked about, that's undone.
Yeah. So I think I'm gonna end with this question. Unless you have another couple hours to spend with us, and then we'll turn it over to Karen and any final comments you have. But this question is there a movement to get guaranteed issue of Medigap plans in the 46 states that don't already have them, that you know of?
I don't know of a movement. There darn should be one. Whoever asked that knows that just very few questions. I mean, very few states. I think Connecticut, New York. I've forgotten the other two. Maybe Maine. Most of them in the Northeast have laws that mandate the availability of Medicare supplement policies without underwriting. That really should be something that takes hold. I certainly advocate for that. If it's maybe that's something that y'all can can consider taking on and leading, because it really is something that's so important. And it, in the absence of that, makes Medicare Advantage such an easy sell for people, for these companies.
Well, let me ask, this is my own question, but if if we were to clamp down on the fraud in the Medicare Advantage programs, and what I assume will be possibly even greater fraud in the ACO REACH programs, is there enough money, if we were to recoup that money and put it into improving benefits and improving traditional Medicare, would we be able to get rid of the 20% Medigap policy?
I think so. I'm hopeful. I mean, let's be real, and it will take money. If you improve the benefits of the traditional Medicare program, you're going to have to find some money to pay for it, and there will always be resistance to that. But it's so important, and it's worth the effort to educate lawmakers about the benefits of doing that. And by doing that, you can reduce the number of people going into Medicare Advantage. So there are ways of looking at this and hopefully persuading them that it's not just an absolute new cost to the government, but you can avoid these over payments to private insurance companies as you reduce the growth of Medicare Advantage.
Oh, that's great. Wendell, I want to thank you so much. This has been an enlightening session. And if there's a way for us, I think there probably is. I'm a little technologically illiterate about this, but if we could copy these questions, only because both so you can see the questions, but it's all the compliments that folks are giving you and how much what you've said tonight has meant to them. We'll send it to you if we can do that. Okay.
Absolutely. I'm very open to it, and I'm gratified and pleased that there's those many questions and comments.
Good deal. And so Karen, come on back on.
Brian. Great. So thank you, Wendell. Did you have any closing remarks you'd like to make?
Only to say that I'm again grateful to be asked to do this. Actually humbled and glad to be a part of the work that you all are doing in some small way. Many of you have been advocates longer than I have. So thank you, and keep doing it, because keep at it, and because nothing is more important in my view. I often say that a lot of us have gray hair and have been at this for some time, and I think most of us are doing this for our kids and grandkids in the next generation. I would like to see more young people involved in this, and so I guess that would be something I would hope that we might be able to do, is to try to figure out how we can bring young people into understanding something that will certainly affect them and impact them, but it's hard for them to see it being so far in the future for them. But that's very important.
Well, we agree entirely. So thank you, Wendell. Thank you for being here. A big thank you to everybody that's attended tonight. We hope to have the Zoom recording available in the next few days. It'll be on our website. And for those of you that registered and that are here, we'll be sending you a link to the webinar. But we're not finished yet. Please don't go. We put together some actions. People want to know what they can do to help save our Medicare. So Mike's going to put something up here for us there. Thank you. So what we'd like you to do is to contact your 2 US senators and representatives. There's a hotline up there that Mike has put up there. Demand that private for-profit insurance companies stop fleecing Medicare. As a start, level the playing field between traditionally publicly funded Medicare and private Medicare Advantage plans. And to do that, that means, as Wendell was saying, adding benefits to traditional Medicare like vision, dental, and hearing, eliminate the 20% Medicare copays, and capping out-of-pocket expenses. It also means eliminating the excessive administrative costs and profits in the Medicare Advantage and the ACO REACH programs, and taking back that Medicare trust fund money that was lost to fraud and abuse by Medicare Advantage plans and ACO REACH contractors. We'd also really strongly encourage you to share this webinar with your family and your friends. There are so many people that we talk with that have no idea what's happening. They're just unaware of what's going on. Plus, if you or anyone you know has a personal story about the effects of delaying and denying care by a Medicare Advantage plan, we'd like you to consider sharing your story with us. Stories are being compiled to influence our policymakers, and you can reach us at organizer@passara.org and let us know your story and if you'd like to share that. And finally, Passara and PNHP Washington will be sponsoring on August 1st a day of action at the Federal Building in downtown Seattle. And that's where our 2 US senators reside and work. And we're doing that in solidarity with actions around the country. If you're in Washington, I hope you can join us. If you're registered, you'll get some updated details in the near future. But if you're from another location, you might consider organizing an action around the 58th anniversary of Medicare and demanding that private for-profit insurance companies stop leasing our Medicare. So Wendell, we truly appreciate the time you spent with us and the work that you do. We're looking forward with continuing to work with you in the future. And we'd like everybody to give a big round of applause to Wendell Potter. And thank you, and good evening, everybody.
Thank you so much. My pleasure.
Thank you.
Thank you.